This segment of DelmarvaLife is brought to you by Delmarva Dental Services.
Has this ever happened to you? It's a hot summer day, like today. You're on the boardwalk or at the fair and you get a nice cold ice cream cone or milkshake to cool you down. You take a bite and ouch! Your teeth feel like someone shocked you with electricity. You have tooth sensitivity. And it's not just cold that causes the pain. Hot foods or liquids, even biting, can make a sensitive tooth hurt like the dickens. So what causes it? Well, we asked the dentist at Delmarva Dental Services.
Yeah, got some big time problems there.
Yeah, we're going to have to work on that. Yes.
You only get one set of permanent teeth, and according to Dr. Joseph Harmon and Dr. Leigh Auchey of Delmarva Dental Services, 38% of adults have some kind of tooth sensitivity as a result of wear and tear on their teeth.
Most of the people are over 30 that have sensitive teeth, but what it is sensitivity to cold, hot, biting, and sweets.
Dr. Harmon says that sensitivity often happens when an inside layer of the tooth called dentin is exposed. Dentin is between the tooth's enamel and nerve.
You have an enamel on the outside of your teeth, and it's kind of like a shell in a way, like a shell over an egg. And anything that breaks through the enamel makes the tooth sensitive.
Dr. Auchey says there are many ways to break that enamel, exposing the dentin.
The way your teeth bite together. Sometimes people have grinding or clenching habits that create some issues.
Other common causes of tooth sensitivity are cavities, a cracked tooth or cracked filling, even sinus pressure.
Sinus pressure is a big one, and especially we live here where there are a lot of allergies and sinus stuff going around all the time. So when you build up that fluid and pressure in the sinuses, in particular in your upper teeth, and especially the back teeth in the upper arch, you will feel that pressure on those roots, and it can make your teeth feel sensitive as well.
And then there's erosion of the enamel caused by acidic food and drink, and conditions like bulimia or acid reflux. You can even cause erosion in the enamel by doing something that's good for your teeth.
The toothpaste that you're using can be very abrasive, and that's something people are doing every day, hopefully twice a day. But also the way they're brushing and the toothbrush that they're using can be aggressive also. And I would say that is a really big one because those are things that people are doing all the time on their own.
Dr. Auchey says brushing too hard can cause gum recession.
The gum tissue actually start to drop down around the tooth, and there will be more tooth exposed than used to be. And that area that becomes exposed can be much more temperature sensitive, in particular, mostly to cold, sometimes to sweet things, but typically when people say I have a little bit of cold sensitivity, it's up here next to my cheek, that's often what we're seeing when that happens.
Dr. Auchey says tooth trauma is another cause of sensitivity, but usually it's temporary.
We see this a lot, especially in the spring and summer, kids playing sports, swimming at the pool, a lot of trauma to the teeth. They get hit by a baseball or they fall on the pool deck and bump their front teeth. So sometimes you'll feel a transient type of sensitivity or discomfort because that tooth kind of gets a jolt, gets a shock. And most times that does resolve itself. Sometimes it requires more treatment immediately, depending on how significant the trauma is.
No matter what is causing your tooth sensitivity, Dr. Auchey says it's always good to see a dentist.
Just get it checked out. It may be something minor. It may be something that you can change a simple habit at home and correct the problem yourself. It may be something that you're actually going to find out you need a little bit of help with, and hopefully not something that you need a more significant treatment for. And Dr. Harmon adds that if the pain doesn't go away or if it gets worse, it could be a sign the nerve in your tooth is dying. He says that's something you should definitely have looked at. To learn more about tooth sensitivity from Delmarva Dental Services, go to our website, WBOC.com, click on our picture at the top of the page. Well, as we just heard Dr. Auchey say, hopefully you're brushing your teeth twice a day. Now, getting your kids to do that may be more of a challenge, so why not make a game out of it?
Help break the curse by toothbrushing.
The free Tooth Savers app for iOS and Android devices asks kids to save a kingdom from bad breath and plaque by brushing their teeth. The cute narration and animated character will guide and entertain kids as they properly learn to brush all of their teeth for 2 minutes twice a day. There's even something to give the parents some motivation to keep brushing. You can now keep dental decay at bay with a high-tech toothbrush from Oral-B that will hit stores later this year. The interactive toothbrush sends brushing data to a smartphone app over Bluetooth. The app will get to know your habits and tell you if you're brushing too hard and for enough time. You can even track your data over time and share it with your dentist. Well, something else many adults deal with: buying or selling a home. Up next, we take a closer look at the housing market and who is being credited for a surge. Plus, if you're thinking about buying a home anytime soon, we'll let you know about some new rules that may soon affect you. And once you're settled at home, let's hop into the kitchen. Today, we're learning how to make BEER-BRAISED short ribs. DelmarvaLife will be right back.